Welcome to the deep dive. Today, we're really digging into something crucial: health equity and how it connects deeply with primary healthcare, or PHC. We're basing this deep dive on a pretty comprehensive 2025 review. It looked systematically at all the recent literature exploring this relationship. Our goal here, to unpack how health equity is actually understood, its real ties to PHC, and maybe surprisingly, why it's proving so difficult to measure well. To really get this, we kind of have to start with equity itself. I mean, it goes way back, Aristotle even, which is fascinating, but applying it effectively in, modern health systems, that's much more recent.
Wait.
And challenging it often feels like this abstract value, doesn't it? Which makes pinning down exactly what it means in practice pretty difficult.
Exactly. And that's a core issue the review highlighted, this definitional challenge. You see equity used all the time, but often it's mixed up with equality or even just seen as like a way to get to equality. So there's not really a firm consensus across the board in the literature. Although Whitehead's ideas are quite dominant, defining inequities as those differences that are, systematic, unnecessary, avoidable, and unfair. And there's a strong focus there on fair access, especially thinking about marginalized groups.
Okay, so if the concept itself is a bit fuzzy, how does primary healthcare actually connect? How does it help make equity real?
Well, that's the key point.
Yeah.
The literature is really consistent on this. PHC plays this vital role in sort of operationalizing health equity. The review found these connections happening in basically three main spheres. First, you've got the ground level stuff, the microprocesses. So that's things like, is there direct access to PHC? What's the actual quality of the care people receive? Are the health professionals properly qualified and trained?
Right, the tangible face-to-face things.
Exactly. And you zoom out a bit to the macro processes and policies. This is more systemic. Like, how is funding allocated? Is it based on need? How are services distributed geographically? How are the care networks organized?
Makes sense, the bigger picture.
And finally, they also found links in the observed results. So actual health outcomes, the overall quality of THC itself, and whether people are using the services effectively.
That breakdown really helps show the complexity. Are there any examples of this actually being tried in the real world?
Oh, definitely. Brazil was mentioned, for instance.
Yeah.
They have this health equity monitoring panel within their PHC system. It's a clear attempt to track specific data for vulnerable populations, trying to put these equity ideas into action.
Okay, so PhD is vital. There are attempts to operationalize. You'd think measuring equity would be pretty advanced then. But here's where it gets really interesting, maybe even a bit shocking. The review found something quite startling about measurement, didn't it?
It really did. This is, I think, a critical finding. Despite everyone talking about health equity constantly, the review found only 47%, less than half, of the studies they looked at actually tried to measure it.
Less than half.
Yeah.
Wow.
And even fewer actually defined what they meant by health equity before they started measuring. Most of the attempts that were made focused on access, which is important, of course. But even there was no agreement, no use of validated tools specifically designed to measure health equity.
So what did they use?
Well, sometimes they'd pull in general indicators, like the Johnny Index, the one usually for economic inequality. But those just weren't built for the nuances of health equity. They don't quite capture it.
And the impact of that? I mean, for listeners.
Well, the impact is huge.
Right.
Without clear standard ways to measure, how can health authorities possibly know if their policies are working? How can they identify where the real gaps are, where improvements are needed to actually promote social justice? It makes it incredibly difficult.
So what does this all mean then, moving forward? The review pointed out something else important too, right? About how we think about PHC itself. This idea that we need to get past seeing PHC as only for low-income groups or certain vulnerable populations, because that view can sort of accidentally create dependence or lead to misunderstandings about universal health systems.
That's a really crucial point. It raises this important question. If PHC is just seen as a safety net for some, does that limit its potential? The review really stresses that PHC should be seen more as an equitable philosophy, something that addresses the health needs of everyone. It needs to be that comprehensive, coordinated first point of contact with the health system for the entire population. It's about fundamental access for all, not just targeting specific groups.
So ultimately, this deep dive brings us to this kind of paradox, doesn't it? Health equity. Everyone agrees it's important. It's a core principle. But in practice, it stays abstract. It's poorly measured. It leaves you thinking. Just imagine the shift. Imagine the potential transformation in public health, in social justice. What if we actually had clear, agreed upon ways to measure health equity? What kinds of policies, what actions might suddenly become possible? And maybe think about what role you, the listener, could play in pushing for or just understanding these changes.